Thanks for your patience. So in the next 20 minutes, what I'm trying to achieve is to give you an overview of how to acquire clinical knowledge or research knowledge related to our specialty. I'm going to focus more on ultrasound guided regional anesthesia. The aim of my talk was to direct this more towards the clinicians than the researchers, because researchers are already very good at acquiring knowledge, producing new knowledge, but it is going to be our clinicians' responsibility to make sure that knowledge gets across to the patients. So as I said, quick overview, and I want to review what is the real need for having this new knowledge. We are all already good at our skills. We practice regularly. Most of us have very little complications. So why don't we just carry on, keep doing what we already know and good at? And then what are the sources available and how to keep ourselves informed? So first of all, it's important to realize most of the healthcare is being delivered by clinicians, and all the research that is happening that is at the forefront of the best of the clinical care has to reach, if it has to reach the patients, it has to be through the majority of the clinicians. So it is a partly responsibility of the clinicians to make sure that we keep in touch with the latest in research and offer that to our patients. And not infrequently, we end up with challenging scenarios where we need to know what is the latest to do with this patient, what is the recommendations by the professional societies for these kind of patients. And off late, our patients are more informed. They come to us after having gone through Google. They know what are the pros and cons of the procedures. So when they pose you difficult questions, you don't want to be in an awkward situation. Certainly, revalidation and licensing requirements have become much more advanced, and they expect you to keep in touch with the latest and the basic requirements that keep changing. Not necessarily in teaching institutions, even in periphery hospitals, there is always some element of teaching requirements, be it to your own peers, where you want to share a new skill, or be it to your subordinates or ancillary colleagues like nursing or anesthesia assistants. So there again, you want to know what is going on and share your knowledge with them. And local performance standards always keep changing, and you want to be sure that you're keeping up to date with that. I wish life was like this game. It'll be pretty easy to play, and you always walk away with some money, and you end up with simple questions like this. A human being normally has only one, and you got an answer there, which you have to pick. And you still got 3 lifelines left. So that's a pretty easy scenario. And if you don't know still, you can walk away with some money. Whereas in real life, you're pretty much stuck in the middle of nowhere often, and there's not many people to help you around. You may think asking a friend might be a best option. We always have trusted friends in our department, friends who know the stuff. And one of the studies, which was done in 2005, compared, getting a colleague's advice and compared with the professional advice from an evidence-based literature. And they showed that they don't match. And the evidence-based literature often quoted different advice based compared to your trusted colleagues' in advice. So have a think about that before we really call who's our best friend in there. So when we put that in picture, we need to have a strategy, how we are going to get relevant, useful information. It has to be pretty fast, and it has to come from a reliable source, and it has to be economical. So I read this paper, which was published in 2008, Clinical Gastroenterology. So they suggest this 4R approach: retrieve, review, reject, and read. When you start looking for information, it's actually overwhelming to look at the amount of articles that are up there, and trying to tease out what you really need might be a big challenge. So it looks a complicated flow diagram, but actually it isn't. What they say is retrieve is started by either an active or a passive search. Active search is you have a clinical scenario which demands an answer, so you pursue a search relevant to that clinical scenario. Passive search is you do it when you got time, when you have, on a regular basis, on a weekly or monthly basis, to look at what is happening in your specialty. Once you do that search, you try to review the articles that come up based on some certain criteria. I don't want to go into the exact details of all these because of the lack of time, but basically you set your own criteria. You want to look at only randomized trials, you want to look at trials past 2010, only in developed countries, English trials, European trials, and then you reject all the remaining, and then you have a most manageable size of data or articles to read, and that probably will be the most scientific and systematic way to narrow down your literature. Once you get to that, then you can go into the details of introduction, methods, results, and discussion. So going to the sources, we got a lot of opportunities in the current world to look at the data that is available. So we got internet, which is common, increasingly common now, available in almost all operating rooms across the developed countries. I put PDAs, which is personal digital assistants, above the text because there's a reason we're slowly starting to becoming more and more digital. And towards the end, I'm going to show a little bit what is available on a PDA. And of course, the good old textbooks have been helping us, but they have started becoming a little bit of an old-fashioned. We'll discuss it why. And then certainly coming to meetings, conferences, and workshops like the ISURA, which is one of the best meetings for regional. Going to internet. So I broadly divided the data that is available into two categories. One is the online databases, and the other one being professional organizations. Let me talk a little bit about how to decipher information from online databases, and then we'll go on to the professional organizations or the college websites. So the common databases that we will tap into, which are relevant to our literature for regional and ultrasound, would be PubMed, Medline, Embase, and Google Scholar. Everyone has a favorite. Everyone finds navigating through one of these more easy than the other. I find PubMed is my favorite. So PubMed is actually it's a part of the National Center for Biotechnology Information, which holds all the journals and articles from the Institute of Health in US, which is one of the largest electronic libraries in the world. So you essentially type in your query in there. If you are going to this NCBI, it's going to churn out a lot of data, a lot of articles rather, and that will be overwhelming because this will take into account all the subdivisions of the major library. But if you want to narrow it down to more relevant to medical publications, you should go down to PubMed, and PubMed, you type in your query in there, and then that's going to generate a much more sizable amount of articles for you to review at. The other subdivision of PubMed is the PubMed Health. So the PubMed Health, how is it different? Is it looks predominantly at the review articles, what works, what does not. So if you go into this search box, you would be getting only review articles in your field, in your search area. And PubMed Central holds all the original articles in full text. So if you don't have access to the journal or a full text source, PubMed Central is a good place to go in to get some full text. Because PubMed and PubMed Health may not always give you a full text. It may just stop at an abstract or maybe not even that. So just a quick few slides about how to search. So let's say we want to know more about perineural catheters for femoral nerve block. The way I try to devise my searches, I try to break them down into smaller relevant pieces of information. So for perineural catheters for femoral nerve blocks, I've divided that into starting with, say, femoral nerve block. You just type in your femoral nerve block in there, and you're going to get a list of articles that are relevant to femoral nerve blocks. And you can further narrow your search down to last 5 years, 10 years, humans, and all sorts of other options here. And then the next search would be perineural catheters. So type again perineural catheters, and that's going to turn out all the studies that have been on perineural catheters in the recent, again, with the same kind of filters. You can narrow your search down. And then you have this button there called the Advanced. So if you go to that Advanced tab, it brings you to this screen where it lists you all the searches that you have conducted, the perineural catheters, femoral nerve block, and it has a number for each of these. Now you can combine these as and how you like using this builder section of this page. So if you add whatever you have here into the builder, and then you can use this conjunction and, or, except, or whatever. So that way your search becomes extremely flexible and narrowed towards what exactly you want. And then it gives you a much more manageable amount of articles in the recent, in the area of interest. So we started off with somewhere around hundreds, and we've narrowed down to 24 articles in your area, which is the perineural catheters for femoral nerve blocks. One thing that I like in this page also is this YouTube link, which is always useful and a handy tip. We don't remember all this time, always how to search or how to narrow down your, how to conduct the search, because it can be quite daunting to see what are these boxes and where to put your information in. So this YouTube link takes you a complete tutorial as to how to perform a search. And in addition, they have a lot of other YouTube videos that come from, again, the National Institute of Health website, which tells you what are the searches, what other searches you can do. Google Scholar is also a good place to start. And say for the same query that we had, femoral nerve block and perineural catheters, if you type that in, it gives you around 280, 290 articles there. And again, you can narrow it down with some tabs. Google Scholar is slightly more wide. It gives you, it still limits the search to scientific journals, but it can expand a little bit more than the PubMed. It covers the PubMed, and in addition, it gets other resources as well. You can personalize your Google Scholar as to what sort of filters you want and how to import it into your own computer library, like the EndNote or Reference Manager. You can have it imported to EndNote or Reference Manager, and you can just get them from the website into your PC electronic library. Next is the set of websites that we have on regional anesthesia is enormous. There's a whole lot of websites that have come up recently that have targeted education and conferences for regional anesthesia. Most of us are familiar with these websites. ASTRA.com is the professional organization website. Likewise, the ESTRAEurope.com is the equivalent for the society in Europe. And then we have the USRA.ca, NISURA, USGRA Web, and the Neuraxiom. These are not the websites like ASTRA, which is like the professional body, but this is more like an institution-based website to promote and educate regional anesthesia. So quickly, I'm going to touch base upon the important aspects that we have that is we should look for. Is the once you go on to astra.com, it is worth to go into if you become. One of the downsides of this website is you need to become a member to access RAPM, and then a whole lot of image gallery there that can be accessed. Membership is not required to access the practice advisories and some of the pain resource material in there. The practice advisories are extremely useful, and it gives you guidance on what to do when there's a local anesthetic toxicity. You can download these as PDF documents, and they can be really handy when you are faced with a patient. What is the ASTRA guideline for this? Say, for example, patients coming with an anticoagulation that is And what do you do? What is the guideline? How many hours do you wait before taking the catheter out or putting an epidural in? Likewise, there are new guidelines on the ultrasound, evidence-based review of ultrasound-guided regional anesthesia as well. If you enter the regional anesthesia and pain medicine journal, then you have this little tab there, which is subscribe to eTalk, which will give you an automatic update as an email to your inbox, giving you what are the latest articles that have come up. And subscribe to eTalk is available in all journals. You just have to subscribe, and they send you the a list of articles that come every month or every other month. The same, this is the equivalent for the Europe. Again, you need membership to access more features of this website. It does not contain much of an educational material. Both ASRA and ASRA Europe does not give you how to do blocks or doesn't take you through step by step. What are the indications of a specific block? And that's where websites like this come very handy. I've used this every now and then in terms of looking into the anatomy and what are the techniques that we do used for the blocks. So I find this as again it comes from our institution. I'm not too biased about that, but I'm just going to take you through that. So we have a section on regional anesthesia. And then there is all this information about conferences and fellowships, workshops, booklets. But what I find really useful, very useful, is the regional anesthesia section. Once you go on to that, you have a list of, on the left-hand side, the general principles, ultrasound equipment, and then the specific blocks. Once you click to the specific blocks, it lists you all the blocks that you can do, and then it goes in detail for each block. Say, for example, if you click on the axillary block, then it takes you to this page where it starts with the anatomy, the scanning techniques, and how to locate it, what are the clinical pearls, and then it also gives you a self-test in the end to evaluate how you're doing. The thing that I like with this website, it's extremely simple and easy to follow, and it has a lot of illustrations. The new addition to this website is the virtual spine model, which gives you a 3D dimension, and you can just rotate and see how the relationships are at the back of the spine. The ISURA is another very popular website. There's a lot of information, ton of information in there. And it also contains a lot of videos, and there's a forum that you can post your questions or get involved into one of the forum if you have friends practicing across the borders to chat about what's going on. This website, ultrasound guided regional anesthesia web from Hong Kong. This one is from Dr. Karmakar. Again, excellent resource for lots of videos, blocks, techniques, and what's happening latest in that part of in the world. Lastly, is the textbooks on regional anesthesia. So we got atlases, review books, handbooks. There is a whole lot of list of books there. It is becoming a little bit cumbersome to carry these books around, to have them, it's becoming more of a library resource than an actual thing to carry around. And another downside of these books are it gets a little bit outdated within a few years. But whatever book you follow, you still need some sort of a guide to have a resource for anatomy of the nerves. Course and the relationship is very important when you track down the nerves, especially with ultrasound. We are able to trace the nerves up and down. Cross-sectional anatomy pictures is what I find extremely useful, gives relationship between the nerves, and that is what you're going to see on the screen, ultrasound screen. So something which says about zona anatomy and surface anatomy are essential, and of course the dermatomes and the nerve roots to make your blocks relevant. These textbooks, I find, this one is more like a reference textbook, this is more like a textbook. Again, these are just examples I'm putting on there. There are many other textbooks, very good textbooks available, which can give a very comprehensive knowledge base on the drugs and techniques. Now, this handbook I find very helpful because you don't have to carry the whole book around, and it's available next to you. Put it in front of the ultrasound machine. You can refer to it easily. And this book, again, there's one more book from Dr. Grau. Again, extensive collection of illustrations and step-by-step directions of how to perform a block. Now that concludes my session on the computer. I'm going to go on to the iPad, just briefly touch about some of the apps that are available. The way that the market is changing is we are moving on from desktop to laptop and from laptop to iPads. iPads or handheld devices, for that matter, are very convenient. You can buy your resources anywhere from any time. It is economical because you don't spend as much as a book. It still gives you a lot of relevant material. So I'm just going to highlight some of the apps that are available and just to show you the ease of using them. So this is my iPad screen, and if you look at some of the regional apps that we got, I find these are some of them are free, some of them are like $4, $5, and it's still very handy to have them. This first one is from the Ulm University. Ulm Rehabilitation Hospital. If you may remember, these people came up with the small handbook that was very popular even before the era of ultrasound, and they have come up with this app which is very nice. You can just click on the anatomy, and it just gives you can zoom in, zoom out, look at all the varying structures. You can go into the sonography. You can slide into various blocks. You can even play a video if you want. So you have all this resource available just within the touch of a button, and it is available handy. Other apps like Medicorp's Nerve Block gives you more information on, these are various applications. You just have to pick up what interests you, what is available at a reasonable price, and it gives you more for your the bug. The one that I really like is this Genius Scan one. It is not necessarily an ultrasound app. It lets you say photograph pictures from textbooks anywhere, and then it lets you store as an image in your as a PDF document in your iPad. It not necessarily be an ultrasound or a regional anesthesia related information. It could be anything, and you can just look at as a photographic document. And it is quite handy to have them for both reference and for teaching purposes. One last app I like to touch about is the Penultimate. So this app is it acts like a book. It's a very good resource for teaching. You can draw stuff on it. You can just erase it. It helps you teach, take notes. And it's a great tool in terms of not carrying a lot of stuff, but just carrying one gadget, and it helps you achieve most of your applications.